I have seen people who are very talkative, very social, and after a stroke to the frontal lobes, they are kind of very quiet, kind of different from that they were before.
We do have ischemic strokes, which means that there's a clot in the sort of a brain artery. That's the most common type. Strokes are more common within elderly population. You can have a stroke at the age of 15, unfortunately. The most important thing is to treat high blood pressure. Then high cholesterol levels. Diabetes is a very important risk factor. Actually, after a stroke, you can be totally symptom-free, or you can have a paraplegia and dysphagia. You're not moving and you're not talking. But it's not very common to actually have a fatal brain infarction. And it's about 10 to 15% of patients who die after the brain.
I'm a neuropsychologist and I work with adult patients, and we are doing neuropsychological investigation, which means that we are kind of scanning people's cognition. So it's everything the brain does. It's kind of reading, writing, drawing, thinking, emotion, memory, perception. What kind of person you are is in your brain.
So what percentage of people suffer from psychological lesions after a stroke?
Okay, most of the patients, I would say almost all of the patients. It's depending on where about the brain you have the stroke. Depression is very often the thing that patients kind of suffer, and also kind of anxiety disorders or things like that. Life changes dramatically.
When Diane was about 3 months, I saw that her right hand was always, her fist was always tight, and her hand was up a little bit, and she didn't try to grab an object with her right hand. They said it happened during my pregnancy, and they asked me if I smoked. I said no. They asked me if I had medical problems. I said nothing, and so they said it was sort of bad luck. We should stimulate her hand and her left leg by playing with her, by touching her, by making her feel different kind of textures. So every week I used to go swim with her, and her leg was better, but it took her a long time to walk, but her leg was better. Her hand was, I think her hand did a little progress because it started opening, but still she doesn't use much her hand. What affects me the most is how the other children or even the adults treat her.
Déjà pour faire mes lacets, et après pour écrire, j'écris pas de la même façon que les autres, j'écris plus lentement que les autres. Et les avantages, il n'y en a pas. Par exemple, pour en sport, j'ai, on faisait de l'escalade et j'ai réussi à monter jusqu'en haut. De temps en temps, ils disent pas forcément pour être méchants, mais ils pensaient pas qu'aussi c'était pour la jambe, c'était que j'étais paralysée du côté droit.
You know, there's somebody missing in the house, so it's mom has to juggle more things in terms of more chores, and then those chores are distributed among me and my brother, so there's more for everybody to do. And that also means that you know, there's generally more stress, so there's you know, things have to happen in a certain order and the right way. If things go wrong, and there's less people to kind of absorb the impact of that. It's really annoying, and also, of course, it's frustrating because we want him to get better, but that can only happen so quickly. So you have to kind of be very patient. And sometimes being patient is difficult. That introduces a lot of pressure on him to improve, but also pressure on us to see him improve and not be in the situation. Probably being kind of stuck in a rock and a hard place, because I have school on one hand, which I need to keep up, and then I have my family that I want to help. Sometimes it's not always possible to fulfill all my responsibilities in the house and also, you know, be in school. So I chose school to won't be able to help out with my mom as much or my brother. It's actually unfortunate.
Your husband's stroke, how has your life changed?
It has changed completely. When I was not working, I started working after that here in Helsinki. I was working before, but not in Helsinki. And plus, you know, right off that, we knew it is going to take whatever recovery it would take a long time. So it has changed my life in many different ways as well, like groceries, and things I do alone. And just basically, you know, he's not there to talk to, he's not there to go with you, and kids, of course, everybody's life has changed completely.
What was the hardest thing for you to get adjusted to?
Not knowing how long it will take, and at the end, what the recovery is going to be.
An explanation as to how it happened, or
There really is no explanation as to, yes, there can be symptoms of what can cause it, but you know, like they say, one of the biggest causes is blood pressure, but there are hundreds and thousands of people with blood pressure, with high blood pressure, but they don't get a stroke. So why this happens in a particular person, they really cannot say. He has speech therapy, he has occupational therapy, and he has physical. His speech has improved a lot. Earlier he was saying nothing, to just words, to small sentences now, and he often surprises us with something that we have not heard for a very long time. So sometimes he's trying to say something, but the words don't come, and so that is very frustrating.
and how does this affect you personally?
I constantly worry about so many things, which I was not thinking of before. Like, for example, I never thought that I would have to do Siddharth's university completely on my own.
There are lots of stroke risk factors, so just detecting the risk factors at an early stage would prevent an enormous amount of strokes: high blood pressure, lifestyle factors, detecting atrial fibrillation and giving patients anticoagulation before the stroke occurs. So there are definitely a lot of ways to prevent strokes if possible, but what is important, I think, would be to sort of raise awareness among sort of young and middle-aged people, especially about the high blood pressure and cholesterol levels and lifestyle factors and how they affect the stroke risk, because we all can really sort of change our stroke risk if we really